Well, welcome everyone. Thank you for being here today. I'm County Executive Joe Parisi. I'm joined today by County Board Chair Analiese Eicher and a number of our County Board supervisors and partners, as well as Anna Moffett from NAMI. I'll be speaking, then the chair, and then Anna will speak, and then any of us up here would be happy to take any questions. Over the past decade, Dane County has made significant investments in mental health and addiction recovery services. We've built a multi-million-dollar-a-year school-based mental health program, partnered with community centers to provide on-site mental health programming for youth, and expanded opportunities to address trauma and addiction. In just a few weeks, we will mark the opening of a brand new Dane County Behavioral Health Resource Center, a one-stop service to better connect residents to mental health and addiction services when they need them and where they need them. Today, we are here to announce the beginning of another critical initiative that will address an important behavioral health need in our community. The 2021 budget will include $300,000 to begin the planning for a mental health triage and restoration center. The triage center will serve to divert those with behavioral health challenges from the criminal justice system and to further extend recovery services throughout our community. A triage and restoration center, also known as a crisis center or a stabilization center, provides services to address mental health challenges both inside and outside of the criminal justice system. It's grounded in the concept of no wrong door, and individuals can access services either by walking in, a referral from the community partner, or be brought in by law enforcement. We're strongly committed to getting those with mental health and addiction challenges the help they need in order to reach their full potential. I look forward to working with the County Board on this next important initiative to help those with behavioral health challenges throughout our community. Now I'm going to turn it over to County Board Chair Analiese Eicher.
Thank you, County Executive Parisi, and excellent timing on our friends doing lawn work across the street there. I am very grateful that the County Executive has acknowledged and embraced the County Board's leadership in this area, and it has included this important initiative in his 2021 budget. Over the past several years, stakeholders and community have researched, discussed, and recommended reforms to Dane County, and the Triage and Restoration Center has been the centerpiece of those recommendations. It's time to take the next step on making that a reality. I want to acknowledge the work of my County Board colleagues in this area. Joining us today are Supervisors Erickson, McCarville, Miles, and I especially want to recognize and thank Supervisors Sheila Stubbs and Carousel Baird for their leadership on these issues. Right now, local law enforcement has two choices. You either take an individual who is in a behavioral health crisis to jail or to an emergency room. A triage and restoration center can provide a positive alternative focused on treatment. Diverting those who need treatment, not jail, is critical. This funding will allow Dane County to plan the triage and restoration center, and there are many factors to consider, including an engagement process to fully hear from the community, a population analysis, the development of a services plan, financial modeling to make this a reality, and the next steps for a phased implementation in the county. Other communities across the country have successfully implemented centers like this, and we can do it too in our own Dane County way. And like those successful communities, the County Board has also outlined a series of actions which depend on the collective work by officials throughout the criminal justice system. Those reforms are currently working their way through the County Board process. The success of reforms like this Triage and Restoration Center will require all stakeholders and community to make changes and be engaged and involved. I'm pleased the County Executive will include this innovation in his 2021 budget, and I'm also pleased to have Anna Moffett from NAMI Dane County joining us today as well.
I would like to begin by acknowledging the deep pain and suffering that our community and country are experiencing right now, as we battle the COVID-19 pandemic, as well as the devastating impact of police brutality and pervasive racial injustice. The impact is most deeply felt by our Black communities, which we must continue to support and center as we seek solutions. Thank you, Dane County Executive Parisi and Dane County Board Chair Eicher, for inviting me to be present at this inspiring and momentous occasion. NAMI Dane County is a proud member of the thriving behavioral health community in Dane County. As the largest grassroots mental health organization that advocate for improved outcomes for individuals impacted by a mental illness, we believe that providing a comprehensive continuum of community-based care is essential. Today, we are coming together to celebrate the county's commitment to creating one piece of that solution, which is a crisis restoration center. For decades, NAMI Dane County has been a thought leader in working towards alternatives to incarceration, the decriminalization of mental illness, and access for all in regard to mental health care. The Crisis Restoration Center moves us a step closer to getting people the help they need when they need it. To bring this entity to fruition, it will take a lot of work and collaboration from across the community. It will require us to break down the many silos that exist in our community and to engage in meaningful dialogue and problem solving. It will also require folks to put their self-interests aside and put a priority on the greater good for our community. A crisis restoration center will also require a significant financial investment, particularly in its early phases. This investment can't solely be the responsibility of the county, but rather it will need to come from our business communities, faith-based organizations, criminal justice systems, nonprofits, individuals, and many more. Our organization, along with others in the behavioral health community, are ready to do this work and invite you to join us. In conclusion, mental illness impacts all of us in one way or another. The needs will continue to grow as we deal with the lasting impact from the generational trauma of racism, as well as the current trauma from the pandemic. The time is now to invest in the Crisis Restoration Center, which will be essential in meeting the behavioral health needs of our community in the future. Thank you.
Thank you. Again, I want to thank NAMI and particularly the work of the Dane County Board and the Dane County Criminal Justice Council for doing so much research and background into what led to the beginning phase of this proposal. And we'd be happy to take any questions. I'll ask the county board chair to kind of go over what the process is going to look like over the next year, because we're in the beginning phases, the important planning section. Do you want to?
Yep. Thank you. So the goal is ambitious. Ideally, we would like to see this opened and functioning and accepting folks in the next 3 years. That's going to require a significant amount of work in our planning process throughout 2021. Locating a site, doing population analysis, the things that I mentioned. But we think if folks are willing to come to the table and be a part of this process, we can move on this ambitious timeline and have this up and running in our community in the next 3 years.
What's the success been like in other communities that have programs like this in place? What have you learned from those spaces and what can apply here?
Sure. So I think, Dane County is unique, and there is a lot to learn from other communities that have implemented centers like this. But the goal is to see the reduction of folks who don't need to be in jail, who need treatment, who need assistance, to have a place for them to go. And that doesn't exist in Dane County. And the places that have centers like these are able to divert folks right away. So they're not entering the system. They are not then, engaged in a way and in our systems that leave them in our systems, for years and keep them coming back. This is about diverting right away at the beginning so that they can get the help that they need and they don't ever come in contact with our system for a simple behavioral health issue.
Have there been any discussions yet with local law enforcement, county sheriffs, police departments, the implementation of the center, and kind of that decision-making process as to when they encounter something maybe in a crisis, when this center will come into play?
Yeah, so those conversations are starting. This is something that we have heard local law enforcement ask for years. They don't have any options. Their option is the emergency room or jail. And they know that they are coming in contact with people who don't need to be in either of those places. And so this is something that they have asked for, they're in support of. They're going to be part of that process, as is our fuller Dane County community, in figuring out what the needs are, how it's going to be run, what services, and all those details, which is why this planning process and this $300,000 in the county exec's budget is going to be so key to making this happen.
That we've seen over the past couple of months, why looking ahead to the future, something like this is important for people struggling with mental health?
Well, I think during the pandemic and also all the other things that are taking place, we've seen a dramatic increase in people needing support. We've seen a dramatic increase in overdose substance use. And I just think as things continue to proceed, more and more people will be impacted and it will take a toll on people's mental health. So something like the Crisis Restoration Center is really an important piece to that. So people, which Dane County Executive Parisi mentioned too around the Behavioral Health Resource Center, just really piecing those all together so there is that continuum of care for people because the needs have grown and I think they'll continue to grow moving forward.
Elaborate on how this is not psychiatric care and the differences for those who aren't as familiar?
Do you want to take?
Or whoever.
I think this is a really great graphic, and I think a lot of the work is still being worked out, but yes, it's not.
Yeah, if you look, this graphic here I think is really helpful because what this isn't is a replacement for Mendota Mental Health. This is not for, the most severe cases, but again, the options right now, if you are having, any behavioral health crisis, wherever that is on the spectrum, your options are jail or the emergency room, and that's not necessarily appropriate. And Mendota Mental Health might not be, Winnebago Mental Health, might not be the most appropriate place. And so this is for, as Anna said, on that continuum of care, one of the pieces that we're missing.
Maybe a bigger picture kind of question when we're talking about this. Just in terms of the county, how big a priority is it right now? Just kind of thinking criminal justice and when people go to jail, some other options than incarceration.
Well, I think for the county board, it's a huge priority. We have had years of work, led by Supervisor Baird and Supervisor Stubbs, and others on the board about, what are the reforms and what can and should we be investing in. And so I think this is a critical time to get this work done. We have accomplished a lot in Dane County as far as simple and easy and quick reforms, and we are now at the hard part of moving into some of the more concrete diversion programs and overhauling systems so that, as a whole, we are in a more just county. So that is a huge priority for the county board, and we actually have a resolution that's working its way through the county board process right now that is not just calling on the county board, but all of the actors in the system to make changes and reforms and work together, not in their silos, but really breaking down those barriers and working together to, make an impact of being able to really truly see reform in Dane County and see some changes being made.
It's early in the planning process. Is this just for adults, or is there going to be a pediatric element or anything with schools?
That's a great question, and I think that is probably one of the questions that'll come up within our planning process.
I know it's early. Is there a site or sites that are kind of on the short list that would be ideal for the location?
that is going to be part of the planning process, site identification. But we want to make sure that it's something that works with, where our existing services are, what folks are needing, and that's, I think, going to be part of the, the community engagement piece and stakeholder engagement piece of this process.
Thanks, everyone. We appreciate it.
Thanks.